All right. We're
What's
all
up?
here.
What's
We're
up?
all good. So, everyone, I just want to wish you guys all an amazing start to our week. My name is Raina Harvey. I'm a journalist out in California, and I'm joined today with Dr. Brian Perry. That's the gentleman you see right there below. Okay, Dr. Perry has a really awesome resume here. He's currently at the Dover, Delaware Bay Health Hospital, and he is an emergency medical physician there. Also trained in internal medicine, really smart, really bright man. But I want to also thank the Rizzo Doctor Instagram page that we're broadcasting from now, and also Dr. Alexander Oladele for facilitating this very important conversation. Look, we've been seeing it on the news, we've been seeing it across the globe. I think it's really important for all of us to engage in this dialogue. So, Dr. Perry, when you see down there, people are going to be asking questions. Please feel free to ask any questions you might have. I'll be taking some notes back here for any of the questions you might have for the doctor. But one, let's just jump right in and get started. How are things out where you are in Delaware?
Okay. Well, as Delaware is a relatively small state. I think we have about 900,000 people in the state, and as far as the coronavirus, we have about 1,700 cases, in which, as of today, we've had 42 deaths. I think we've kind of seen a phenomenon throughout, from January on to now that has been very interesting to follow. And so, uh, the ER, was kind of filled with patients. A very small percentage of patients who came to the ER had true emergencies, but now we're seeing like a lot of people have fallen off, and they're truly doing what they're supposed to do, which is calling their primary care physicians and not coming to the ER. And so, we kind of started with this like new disease that nobody knew about, that was kind of like folklore way over in China, to like us hearing reports of it coming to the United States, to like people actually coming to the ER with symptoms where, I might have to test them for this. And over the weeks, we've seen, I've seen more and more people that we've had to test for. And so where I might have tested for like 2 or 3 people per shift, now I'm testing 7, 8 per shift. And then now we're kind of in this phase where the people who we've already tested, they kind of know their status, and now they're on their second and third presentation to the ER. But as the weeks go by, people are kind of becoming a little bit more sicker, and we're seeing the hospital admissions kind of incrementally go up. Although I will, put the caveat in that we're nowhere near as bad as New York, but I think, emergency medicine across the nation, we're kind of seeing some similar trends. And, the thing about this coronavirus is that, every state, every city, every municipality will have their hotspot time. And I think we're predicted to peak in Delaware sometime between April 18th through the April 20th.
Okay.
So, it's going to be, all hands on deck. But right now, it's kind of been like a steady calm before the storm. I don't know if you watch Game of Thrones or not, but there's one episode where everyone's trying to get ready for the war. The Night King is coming, and it's just everyone kind of mentally and, preparing themselves for, disaster medicine, honestly.
Exactly. Yeah, I've watched the entire series of Game of Thrones. But like you mentioned out there, getting ready in Delaware, you see areas like New York that seemingly exploded overnight. Here in California, we've got a lot of cases. So for you, how have you guys been able to prepare and plan with what you're being able to observe across the United States?
Absolutely, absolutely. So, I've always a fan of hope for the best, but prepare for the worst. And I think we've had a really good hospital administration that have made extensive preparation for this wave. So we have on-call doc lists. We're recruiting doctors from different specialties. Doctors who are like PCPs or primary care physicians who are in the community where their volumes are shut down. They're being recruited to the emergency room as needed. We have a tent outside of our hospital where that's only for COVID patients. And I think it's important to separate, COVID versus, regular medical complaints. And as this time moves on, the regular medical complaints kind of slow down, and then, the COVID kind of picks up. But, it's all hands on deck. It's knowing the actual steps to, putting on your PPE, taking off your PPE, how to successfully intubate somebody, to minimize your risk of exposure and the viral load. We have proper protocols in place to, when people come in and they need CPR, we have a strict algorithm that we need to follow, and that keeps, everybody safe, because it's a scary disease.
Yeah, I mean, the understatement when you say scary. Now, Mitzi 91950 asks about layoffs. She says, do you guys have enough staff? Hospitals all over the country are laying off doctors and nurses. So how's the staffing down there?
Excellent question. So I think we're refocusing our attention. So if you think about a hospital, there are different arms to a hospital, and if you think about the revenue that a hospital will make, a lot of them come from elective surgeries, or elective procedures, or if since those elective procedures are no longer needed, or we kind of putting those things on pause, then clearly, like, the revenue is going down. Clearly and we clearly need to recruit and kind of put all hands on deck in the ER, in the ICU, and in the hospital wards. So a lot of people who are in the outpatient realm, or might be in the elective surgery realm, they're seeing, like, numbers go off. And hell, even in the emergency room, we're seeing our numbers kind of have fallen off, which, but we know that that's the calm before the storm, because we know that people are actually staying at home, which is a good thing. But I think to a certain degree, we kind of have to, like, reverse things a little bit to say, hey, if you're having chest pain, you might be having a heart attack. Like, even though there's some coronavirus, you still should come into the ER, because, we have areas where you can be seen that is kind of separate away from the coronavirus patients. But I think again, it's a caveat, Delaware is a very small state. But I do believe that we have enough staff, and we have, plans and procedures in place for when things get crazy.
Excellent, Doctor. We've got some great questions coming in. Okay, so we've got one here from Abinia. I've been hearing that almost all masks do not protect from COVID because the virus is so small. Any truth to that? I know we've been hearing about, the masks that protect, and now they're asking out here in California for people to wear any type of mask that they can wear just to leave the house. So what would you recommend when it comes to masks?
Yeah, so interesting. If you, like, look at the culture between, like, the Chinese culture and what they did in China, and what we're doing here, like, a lot of people wear masks to prevent other people from getting sick, right? And that is the name of the game. That is the concept behind why we should wear masks in public, and it's not necessary to protect yourself, because we know that coronavirus is transmitted via droplets primarily, but it's a small enough virus to where in some situations it can be aerosolized, meaning it can linger around in the air and you breathe it in without knowing it. Now, it's not anywhere in the, like, realms of, like, smallpox where you can, or measles, I'm sorry, where you, like, breathe it in and it stays in the room for 13 hours, and as soon as you breathe it in, you're, like, sick, and not to that degree. But the concept is to protect other people from getting the virus if you are an asymptomatic carrier. And since we don't know the true penetrance of the disease, because we don't know who's asymptomatic, and that's where the antibody testing will come in, we don't, it's one of those things where a mask is better than no mask.
Right.
Okay. And so it's not, the masks aren't really to protect yourself. It's primarily to protect other people from getting it. And then there are different degrees of masks, so there's, like, the low grade mask, your bandanas, your do rags, or whatever, that you just cover your face that prevents the droplet. You can still breathe in, the aerosolized form if that is the case. And then, there's the surgical mask, which gives you a little bit better protection. And then the highest protection gives you is from the N95 mask, which are typically the turquoise masks that you see people wearing. And those patients, and, that prevents the aerosolized form of the coronavirus from actually breathing it in and getting into your respiratory tract. Yeah.
Now, you mentioned something key. You talked about that antibody test. Now, we've been hearing the president held a press conference yesterday talking about that antibody test, talking about different companies trying to create and come up with this in order to get and know who has been exposed and get people back out into the workforce. So can you describe for people who may not know about this, what that is? And do you think it's going to help us get the country moving a lot quicker?
Absolutely. So a couple of things. The first thing is the antibody tests will give us an idea of the true penetrance of the disease throughout the population. Right now, when we're talking about the area, flattening the curve, we're talking about the incidence. That's the number of the rate of new cases per day. And what we do know is that the deaths so there's new cases, and then there's hospitalizations, and then there's ICU admissions, there's intubations, and then there's deaths. And so there's that progression that is kind of along a temporal means. And so the incidence will give you the new cases, but we know what we're seeing now is that the deaths are now peaking, but the incidences are kind of slowing down in New York City. I would say in New York City, or at least plateauing or stabilizing. Now, when you talk about the mortality rate of the disease, right now you come into the ER, you have symptoms, you get tested, we know that you have coronavirus. So the people who have symptoms are the people who are getting tested.
Right.
But we don't, but if we were able to capture everybody who might have been asymptomatic, then we get a true idea of how much that disease is afflicting the population.
Right.
And I believe that antibody test will make the mortality rate go down, because now we know that there are all these cases out there, or these people who were exposed or fought the disease or got over the disease and have antibodies toward the disease, which I think will give the American population a confidence in order to go back to work. As a physician, I would love to go to New York City and help out. I would love to do what I can and do my part. But I need that confidence to know that either I had the disease or I have the antibodies against it. So I think that's going to be key. And right now, and I know that's like the sexy topic within the news right now, but they are in the process of making sure that they have the test, but they want to make sure that the test is accurate. They want to make sure that there aren't a whole lot of false positives or false negatives that would give people, inaccurate confidence, or, worst case scenario would be someone tests positive for the antibodies and then get the disease. And then there's still a lot of questions that we don't know. There are some reports of people who might have been co-infected with the disease, or they have the antibodies, or they get the disease again, or they test positive for the disease after they test negative. So the clinical question is, did they, get reinfected, or did they just not fully clear the disease to begin with? And so those are all questions those are all hot topics of research right now. We don't know the answer to.
Right. So I feel like you answered my next question about, once you catch it, can you catch it again?
So just knowing anything about immunology, I think once you develop antibodies toward, the antibodies are toward a particular protein that the virus has that marks that protein and marks that disease, and it alerts your rest of your immune system that, we need to kill these cells or kill this disease. Um, uh, so antibodies are highly, highly, highly specific to proteins. So if theoretically, and I'm saying theoretically, if you get the disease, then and you recover from the disease, the likelihood of you getting the same exact disease or the same exact virus is I would say low. And if you did get it, your body would clear it. Now, what's unknown, and the reason why we have to get a flu vaccine every year is there's something called antigenic drift. So these viruses, mutate, very subtle mutations, and some of those mutations could alter the proteins of the viral capsule. So we don't know how the virus is mutating, and people, you're probably hearing reports of how it will be a seasonal thing, and I think it's because of that as well. But it's still unknown. But nevertheless, if you have antibodies against the coronavirus, I still think that gives you more confidence and less fear than having, be just kind of flying blind in the dark and not knowing. And then, we actually, the Italians actually left us a really good blueprint of what to expect and what they saw. And everything that we're seeing in ER now is exactly what they were seeing before. But in the they said about 10% of their employees got sick. So that's also something that we need to prepare for too. But as a healthcare worker, I mean, it's scary. It's scary going in. I had one patient who was a trach patient who had several surgeries and was hypoxic and bleeding and spraying through his trach, and it's a scary thing. So you have to make sure that you're fully gowned, fully gloved, fully masked up, and in the worst case scenario, sometimes I will have an N95 and something called a PAPR, which is basically a helmet with a vacuum that kind of gives you the maximum protection.
You got
it. Yeah, it's just very scary.
Got to be protected. A lot of great questions, so we're going to try to get to as many of them as we can. You kind of already addressed Sadi's question about that strain and how likely it is to mutate, but let's talk about the communities of color. Like Kenneth brought up here, we know that we are seeing some new reports in different states. I mean, you see them across the United States and Louisiana, where we're seeing communities of color, African American, Latino communities that have been really impacted by this virus times two. Okay, and for you and I talked a little bit, doctor, about cases that you have seen personally. So what is it and why are we seeing this have the effect that it is on our communities of color? And as a physician, as a doctor, what advice would you have, and how do you even broach the conversation when someone comes in and they are at a higher risk?
Absolutely. Well, I'll tell you, I'll repeat the story I told you earlier. I had a patient. She was a Black woman. She was maybe in her late 50s. She worked in a nursing home. There were other positive patients there. She came in with all the classic symptoms. She had a fever. She had a cough. She had shortness of breath. She's never really happened to her before. She was supposed to be on blood pressure medicines, but hadn't taken them in several months for XYZ reason. Normal X-ray. I did a lung ultrasound on her. She had a focal consolidation. She had basically an ultrasound that was suggestive of coronavirus. And I told her, I said, hey, I have a really high suspicion that you have COVID. And, at the time when we test, like the test would take, like 5 days to come back at that time. But, now the test is coming back within hours, which is a good thing. But nevertheless, I told her, I think you have COVID. And her response was, no, we're not going to put that out there right now. I'm trusting in the Lord. I got a God that's higher and mighty, and we're not gonna speak that into existence. And my response to her was, well, I'm never one to like knock someone for their faith because I have the same faith as well. But I told her, I said, hey, listen, God made science, and maybe this is maybe this is a means of God speaking to you and kind of telling you to, wake up. So she wasn't quite sick enough to come to be admitted to the hospital. Her oxygen levels were fine. She was a little tachycardic, but she didn't meet admission criteria. So I sent her home, and I told her that she needed to quarantine herself for 14 days. And her response to me was, 14 days? I got kids and rent due next week. And what am I going to say? What am I going to say after that? As she was walking out of the ER, she ripped off her mask and she threw it in the garbage. And in my mind, I'm like, wow, how many more people is she going to infect? And I think this particular story in this case kind of highlights a lot of, issues when it comes to communities of color, whether it's the distrust of medicine, and that's a well documented phenomenon, and there's a reason for that. To like medical noncompliance, which I'm not going to blame her or blame the whole population for, but she was kind of an example of many. To a willful denial of reality. And I also think that there is an educational component, and I'm not saying that about everybody, but that she was one case of and Rousseau Doctor, we're an affluent community where we're intelligent, we're data driven, but there's another subsection of people who don't get it and don't understand it and just kind of see what happens in the news and don't realize that this is something very, very serious that you need to take serious. So I would say trust the science. The other thing that I would say regarding communities of color, I think this is a great opportunity to discuss goals of care and with some of our older population. And it's not, these are hard conversations to kind of have with your loved ones, but the best thing that you can do is know what your loved one's values are and how they want to be taken care of if they got to a point where they were too sick to make decisions for themselves. And I think most people kind of fall into two camps. And one camp is that no matter what, if I have a heartbeat, no matter, I will pay the sacrifice to be here on this earth, and I will fight to the end, even if it means that I wouldn't be able to do what I could do before, or recognize my loved ones. And those are people's values. And then there's another camp of people who say, you know what, if I know that I'm going to die, I've lived a good life, and I would rather leave here without a lot of pain and suffering. And just kind of just knowing what camp your family and friends kind of fall in, helps. And it's one of hope for the best but plan for the worst. But everybody has to leave this earth at some point in time. And I've seen a lot of situations where the there's never a discussion about how people want to be cared for, and people are kind of left to guessing, and then it causes tension within families. And ultimately it's best to kind of have these kind of conversations when you have someone in their right mind, and in their right, like they can tell you what they want, so that way you're not guessing. But you just kind of do your and that's where I do for my, the intubations and the critical care. Like that's something that needs to be done for patients. But really, I think a lot more goes with just simple conversations and simple education, and having conversations about goals of care. That I think that goes a long ways. Oh, we back. We
We
back.
back.
We
Okay.
back.
You know,
I don't know what the last thing y'all heard was, but
back
we
up.
here.
Back
We
up.
out here.
Because I lost you for a sec. I'm like, where do you wait? Pick back up.
What's the last thing you heard?
We were still in the conversation about our communities of color. That's the last thing that I heard. So
Okay.
before we go from that topic, because a number of people were asking about smoking and vaping, can you kind of just cap that off, right? They said they heard everything you said, Dr. Lewis. All right, so I'm going to switch gears and I'm going to go into a question that I saw underneath the thread, and we talked about smoking, we talked about vaping, and you know whatever choice of smokes people typically like to partake in. Someone asked, does that increase the risk of death by COVID-19? Does that make it more difficult? I know people with asthma and things like that, but how can smoking increase your chances of, you know, not beating COVID-19 if you were to catch it?
Yeah. Smoking definitely is a risk factor for patients who don't do well, mortality, and I mean, it makes logical sense. Like you're doing something that's going to damage your lung, and this disease is a disease that damages your lung.
Right.
So if you have less reserve, you're starting the race at a disadvantage. So if you are a smoker, this is the perfect time and you've been thinking about quitting, this is the perfect time to do so.
Okay. Now, from earlier, there were a lot of questions, so I was making some notes of things that people were asking along the way. They were asking about for your staff there at the hospital. Have you guys been asked to go to different areas to help? We had someone that asked that. Also, there was a question about when you go to the store and you're buying groceries. What's the proper way to disinfect those? Should we be disinfecting things? I know I saw a study yesterday that talked about our shoes when we're walking in the house from being out. What's the proper way to go out into the world and do the things that we still need to do that are so critical? So grocery shopping, we still have to do that. Many of us still have to go to the bank. A lot of us still have to go to work. So how are we preventing the spread of that in our homes? And circling back to communities of color, a lot of us live in households where it's very hard for us to social distance. You have children that are in the houses with their grandparents, and families that are not working. So how do we protect ourselves when we're going out into the world and coming back into our homes?
All right, I'm gonna take each question one by one. So first
Okay.
question regarding regarding our PPE, or if we have to have hospital staff, go other places. I mean, the ED is a hot zone. The And so I'm not going anywhere. If I were to go anywhere, it would be to the ICU, because doing the whole combined emergency and internal medicine residency, it kind of gets you in a good position for ICU level of care, and also emergency level of care. But we, like I said, we are recruiting people from the outpatient realm, people who might be in family practice, or to come into the ER and see other patients who might not be as sick. Maybe just need a little oxygen here and there, maybe need a lower workup, maybe even, just needs to be discharged and with a little watchful waiting. So that's question number one. Question number two regarding the groceries,
Mm-hmm.
and how to. So I am kind of stepping a little bit outside of my expertise, but I will say, based on the literature and what we do know, that the studies that they have done where the coronavirus can, they've looked at the time frames it can kind of last and stay on an item. So I think plastic, it can stay on there for a couple of days.
Wow.
Paper bag, being on a paper bag. So I would probably recommend someone getting a paper bag. Make sure you have a mask. Make sure you do the social distancing. A lot of grocery stores are having these I don't know if you've seen them or not, but these plastic shields, so that way if you cough, you have some type of barrier there as well. And then as far as bringing your groceries in the house, What I've seen on like CNN is that some people, you know, if you have a perishable, a non-perishable item, um, then let it sit for 24 hours, you know, before you put it into your, you know, put it into the kitchen or, you know, the pantry or whatever. And then for things that are perishable, depending on what it is, you know, you can kind of wipe it down with a wipe or not. But I think a lot of it is common sense, honestly. You know, just making sure you wash your hands frequently. You know, when you come in to the house after being out, you know, make sure you, like I said, wash your hands first and foremost, and then take off your mask. Um, and then, so yeah, I think, you know, we have to go in the grocery store, and then I think that people are recommending like buying a week's supply of groceries as opposed to like 2 months, because you know you got to think about the next man. You know, you don't want to have someone. You don't want to take away things from someone else. There's actually a funny story, like in the emergency medicine group, Facebook group. There's one post there where a guy was in the grocery store and noticed someone else had like a grocery bag full of like hand sanitizer, or a basket full of hand sanitizer. And that doctor went up to this person and was like, you know, you should be ashamed of yourself. You should be like, you're hoarding. You know, you got to think about the next person you're taking away from everyone else. And the and the person responded, well, are you done? Because I would love to get back to restocking the shelf.
Oh, wow.
So anyways,
You know what? I personally have not seen hand sanitizer in any of the stores that I've gone to. But I mean, you know, we don't want to hoard. We want to make sure that we save some for other people, especially when I see, you know, older people that are out shopping and they can't get the things that they need. Um, so I guess the biggest thing is we talk about a change in behavior. And I always try to look at it as like not faulting people for seeing a lot of the things that have been going on, the overbuying, which is not good to do because we buy it up from the people who need it the most. How do you feel like this is going to change our behavior as a whole, as a country, as a nation in the next few weeks? You know, how do you feel like this is going to change the way that we operate as people as a
yeah.
whole?
Well, one thing that I've definitely seen is that this disease has taught us, this big bad great American country, that you know we are not invincible.
Mm,
Um, we are not. We're still vulnerable. This disease does not discriminate, which is a great thing, because I've seen a lot of people come together in ways that they would not have. And I've also seen, you know, people take interest as a public health measure, to protect those around them. And, you know, some affluent person, you know, has an interest in making sure that, you know, a worker up under them, or you know, a nanny, you know, they have masks,
mm,
so that way they're not bringing it into their environment. So it's like, you know, doing the things that I do think that one of the good things is that A, we get to spend a lot more time with our loved ones. B is that we get to uh, think about everybody as a collective,
right.
as opposed to just our own little box. Um, you know, it's going to take some time for us to gain the confidence to get back to and get back to where we were. I don't believe that it will happen overnight. I think, yeah, if I'm being the most optimistic, I would say by the end of the year. But
Okay.
that's just me. That's just my guess. We, of course,
Yeah.
you know, the disease is going to do what it wants, and you know, kind of have to make those decisions based on data and you know, and information. Um, and once we get more data and more information, I think we will have less fear, because we know what we know. But you know, in the point in time where like nobody knew what the heck was going on, people were blaming 5G
Mm,
on the spread of the coronavirus, and it's just all this misinformation that was just seeding and going out and being distributed to the point where I think people were like tearing down 5G towers. And
Mm-hmm.
I think it shows a side of human nature in general, because we want to understand, we want to have a means of control. If we can understand, or if we can place a blame on or put a cause or root of something bad, then we can then understand it and then control it. But this is one of those things where it's just completely out of our hands, and what we do matters. And so uh, it'll be very interesting seeing how this evolves. And it's been a very interesting time frame for us, that it's kind of flipped the world upside down.
Big
And
time. Big time. For people that are tuning in across the world, I saw so many different countries tuning into this live with a lot of great questions for you. How would you say is the best way to get information? Like you mentioned, the 5G, I heard that well from people. What is the best way for people in their individual communities to get information from their medical providers?
the CDC website is pretty solid. As far as information, I reference that website and print out several handouts for my patients on a day-to-day basis. Sources that are the WHO, the sources that are credible. I do watch a lot of CNN. I watch a lot of YouTube videos, and just kind of to stay, on top of what's happening. But yeah, there is a lot of misinformation out there. And but I think the CDC is probably my go-to resource. And Dr. Fucci, of course.
Yeah, I've been listening, tuning in to him. Hey,
Yeah.
someone asked something about hand sanitizer. I know we could be going all day. Is there a lasting message you want to give to people? Does anyone have any lasting questions? I know someone asked about making your own hand sanitizer, if that's safe to do.
What I've seen is, as long as it has 60% alcohol, first and foremost, washing your hands for 20 seconds, um, like, is the best tried and true way of getting rid of the coronavirus. Coronavirus has a lipophilic protein, lipophilic membrane that soap basically comes in and destroys it. So first and foremost, I would not use hand sanitizer as a replacement for washing your hands. You should wash your hands on top of hand sanitizer as well. And hand sanitizer can also be a little tricky in the sense that it might give you a false sense of like cleanliness. But when they've looked at hand sanitizer versus washing your hands for 20 seconds, uh, you know, kind of beat out those hand sanitizers. And the hand sanitizers won't always get to places where you need them to go. So there are areas that are uncovered. There's a good YouTube video on this channel called "It's Okay to Be Smart," where they actually like looked at all of these things: hand sanitizer versus washing your hands versus
Okay.
the foam soap versus liquid soap versus Lysol, and so actually a really good it's a really it's a really good informational video. And that's the video that I use to send out to like all my like loved ones as well.
Perfect, perfect. And I know Bomb Shelly Beauty One, I think you answered this question a little earlier, but I think this is a great way to segue out of this conversation about people and how this as a whole, uh, COVID-19 has affected and will change us. I know for me personally, as a journalist, I mean, and you guys have probably seen this in your cities and your local news markets, how it's changed the way that media is disseminated. So you have a lot of broadcast journalists right here from home, from their houses, from their couches, and they're still able to put together stories with Facebook Lives. I think how this has changed us is it's really changed the way that we've communicated. Me and you being able to go live on Instagram to give information and take questions from people in the comments about things that they want to know about. I think that's so important. And I think that's something that's not going to go away from here moving forward. Um, the way that we digest information, the way that we spread information. And Map asked, what is that YouTube name again for that video? He'd like to know.
Well, the channel is It's Okay to Be Smart, and it's kind of like a PBS YouTube channel where they actually post a lot of things about like explaining what flattening the curve means and looking at the different hand sanitizers and whatnot. It's a really good, interesting video. Like, I'm a low key nerd myself, so like I will watch videos on that channel just out of curiosity. But they've done a lot of good coronavirus stuff. So regarding how we're going to interact, interesting question. I've asked people, like, if at the end of this coronavirus, will there be more marriages or divorces? And then some people said that there'll be more babies than marriages and divorces. But sort of like the social dynamics of this coronavirus, I think it's very interesting because we're learning that it is possible to connect and in social isolation. Mm-hmm. I am kind of old school in the sense that I don't think that it replaces like face-to-face interaction. I'm someone who, and I think it's also shown us how much we depend on each other. It's shown us how much we need to interact with each other in order to, create some type of sanity, and that need of human interaction is amongst all of us all. So I would hope that this isn't the new way of life.
Right. Big time.
But, I can definitely accept that this is the way of life for now. And, I do think things, I honestly think by June 1st, we will start to be kind of I think by June 1st, like the testing will be ramped up, different places might have their little peaks in the hot spots as well, but I think the majority of it are majority of the cases in the like metropolitan hot spots will be kind of on the like down slope, and it'll be interesting to see how we logistically open the country up, but we have to do so in a way that we're safe,
exactly.
Safe and confident.
Exactly.
And we need more information in order to know, if we are safe and if we're confident. So I think that's where the antibody testing will come into play, as far as like how and to what extent, I'm not sure.
Perfect. And just like you mentioned, the CDC being a really good source, the WHO, World Health Organization, QT Breeze, I'd say my biggest piece of advice for you in finding a news source that you can rely on is, what news source and outlets in your city or wherever you are, what state, that have a gold standard of not just being first, but being right. What source have you consumed as you've grown up and into your adult years, where they're not just worried or concerned about being the first to put something out there, but they're concerned about being right and factual? What journalism sources are you using that are about information and not so much opinion? I think that is what really differentiates. They're listening to news and they're giving you numbers and they're factual information and they're citing where they got that information. So if they're giving you numbers, where do those numbers come from? If they're telling you things are bad, where are they getting that information from? Accurate sources are always able to cite where they get their information from. So hopefully that helps QT Breeze there about his information. Okay, doctor, I don't know if there's anything else you want to leave with the people that are out there. How can they reach you, get in touch with you? They have any other questions that didn't get a chance? Someone asked, are we going to save this live? yes, I believe these lives do get saved in some capacity, so they'll be able to go back and look at that information. But anything you want to leave people with?
Absolutely. Just, love others as you love yourself. You know, think about the next man as opposed to just what to do to keep yourself protected. And, if we truly, you know, do this in a non-selfish,
Mm-hmm.
mentality that I think can be challenging. I think we can certainly get through this, and I wish everybody all love, all peace, love, and positivity.
Beautiful. All right, everyone who tuned in today, look, this would not have been possible without all of you. Definitely, there are a lot of questions out there, a lot more questions than answers, but it looks like working together, we're trying to figure out those the answers to those really hard and pressing questions. Continue to ask questions. Continue to be informed out there. Continue to protect yourself from misinformation. Also, being able to reach out to your own medical providers and your own doctors with your own questions, because again, we all have different health history. So something that might affect me might be different from someone else. But we thought this was very important, especially to get out to this community, because this is what our platforms are for. And if we're not using it in this way, how are we using it? Dr. Perry, thank you so much for logging in today and sharing all of that great information. And how can they find you? At your Instagram or?
Yeah, I guess my Instagram is at Parker Lewis MD underscore MD. That's me.
Beautiful. Excellent. And my IG is at Raina Harvey B right here. If you guys want to reach out, have any more questions, definitely will be available to you guys. So on that note, I guess do we log off?
Yeah, absolutely. Cheers. Thank you. I really appreciate it.
All right. Take care of yourself, everyone out there, you and your loved ones. All right.
All right.
Bye-bye.
Cheers. Bye.
Bye-bye.